Okay, this video is a book review. The name of the book is Retaining the Mind. The author's name is William Walsh. He's a Mayo Clinic trained allergist. And the subtitle of the book is How the Foods We Eat Affect Our Brain. This book is an example of a book can surprise me and teach me something useful, and therefore it's valuable to me, but at the same time, the author can be very stupid about other things. So this guy is an allergist, and his idea of evaluation of food sensitivities I thought was interesting. I don't really know that much about this sort of thing before reading this book. When it comes to diet, though, he's a moron. I mean, that's like the joke of the book, is he's writing about how these different food sensitivities he believed caused cognitive impairment and how he recovered from his cognitive impairment. He describes himself as having reversed early Alzheimer's. But then what's funny about the book is he talks about his diet and he says, oh, how he loves to eat beef and pork and eggs and salmon and bacon. And I'm like, you stupid idiot, you're plugging up your arteries. Maybe that's why you had problems with cognitive impairment. Anyways, he remembered a time when he had to give an introductory speech and he started having dysarthria, inability to pronounce the words, inability to remember the words correctly, almost like a TIA, transient ischemic attack, like almost a mini stroke. But be that as it may, for many years he was an allergist and he figured out a pattern of diagnosing food sensitivities. So let's real quick talk about what's the difference between a food allergy, an intolerance, and a sensitivity. So a food allergy is something that is a problem for the immune system. That's the key point. It's an immune system problem, and it's a reaction, an overreaction, exaggerated reaction to a food protein. So it's a big molecule, a big protein. Okay, and it always happens when the person is exposed to that protein. It can be triggered by a very minimal amount of the antigen, the allergen. So that's why you would want, like, let's say, nobody to have peanuts in the kid's classroom, all right? It often occurs very suddenly after the person eats the food, like within 30 minutes, if not sooner. It can begin with a tingling in the mouth. The person can have hives, skin rash. They can get shortness of breath, hypotension, tongue can swell up. It could have a full-blown anaphylaxis. They could die from it potentially. So the only treatment for these people is to avoid the allergen and to have an EpiPen in general. So that's a key point. Immune system reaction to a big molecule. A food intolerance is more like a digestive system problem. For example, a lot of people just can't digest lactose. They don't have the enzyme lactase to split the lactose into glucose and galactose. Actually, most of the world's population has this problem, about 75% of the world's population. So they'll get gut symptoms, and it can occur even a day later sometimes. Okay, then the next thing is food sensitivities. Now, food sensitivities are more obscure. They're a limited ability to metabolize a food. And he says that a lot of people have more effective metabolic systems when they're younger. And as they get older, they sometimes lose the ability to effectively metabolize some foodstuffs. And these are smaller molecules, for example, too small to cause any type of allergic reactions. These are not allergic reactions. He says the most important one to be aware of is glutamate. He specifically says MSG, but it's also MFG and glutamate in general. It's always glutamate because glutamate is an excitatory neurotransmitter, especially in the brain, but in other parts of the body as well. It still has cell receptors that make it important. So what does he say happens? He says that a person can eat small amounts of it and they might be just fine, but when they eat beyond their personal threshold, they will get symptomatic. Their metabolic enzymes for processing it are overwhelmed. He says this is based largely on his experience. He had personal food sensitivities to the molecules we're talking about here, most of them, and then he noticed that he was seeing the same problems in his patients. But he says you can't confirm these with a laboratory test because they just don't work well to try to test food sensitivities. It just doesn't. However, he says the way you know something is correct is the patient stops eating the food and they get better. And if you restart the food, they get sick again with the same symptoms. He says it typically takes about 3 days to clear food out of the gut, out of the colon. Some people will say longer than that, up to a week. But in his experience for food sensitivities, usually 3 days is enough to clear the colon out. The most important food sensitivity is the MSG, like I said, the glutamate. But anything else that, because in my recent lecture about glutamate, I reviewed all the different names of how it can be hidden in lots of different foods. You just process the food and you free up the glutamate from the proteins. So he goes through that whole basically same list. But then he talks about other things that will cause food sensitivities. In particular, he talks about citric acid. And citric acid, he claims, is a food sensitivity item, not because of the contamination with glutamate, as was talked about in the previous lecture on glutamate, as it often is when it's produced by bacteria. But he's talking about the citric acid that comes from citric fruits. He actually will not eat citrus fruits for that reason. He says you can get these same things from corn, from gluten. Gluten is very high in glutamic acid, glutamate, and is often highly processed, freeing it up to get more free glutamate. But also, he says he can get this from simple sugars. So he says as a person gets older, in his opinion, and this is an old Mayo Clinic trained allergist, he says people often become less able to handle simple sugars, refined sugars. He says lactose, there is the food intolerance thing that we talked about. Your gut can't digest it. But for the people who can digest it, they can run into problems from lactose as well. He says the vast majority of them do have a problem with lactose. And lactose is kind of weird, the milk sugar. So let's say you split it into glucose and galactose. The galactose can cause a lot of problems. That's why dairy is associated with cataracts. It can also be damaging, like to the ovaries and stuff. You don't want to be ingesting cow milk as you get older, unless you're starving or something to get you through a freezing cold winter. But just because you can split the lactose into glucose and galactose does not mean your body is capable as you get older of metabolizing the galactose, and it can cause problems for you. So I would recommend that's another reason why you want to avoid cow milk. Tomatoes can cause problems. Peanuts, quinoa, he said, can also cause problems. Let's say, he says the typical scenario for him and for a lot of his patients is they would eat too much glutamate, and whatever the source it was, and they would sometimes get abdominal distress, bloating, constipation, diarrhea. Sometimes they get headaches, rather severe headaches even, from routine headaches to migraines to cluster headaches. I put the page number there if anybody wants to look this stuff up. Insomnia, which can be severe. He said sometimes he would sleep poorly for 2 days in a row, till the glutamate was getting cleared out of his system from his intestinal tract, the excessive amount of free glutamate. He says it can sometimes cause irritation of the nerve that goes to the face, the sensory nerve of the face, the trigeminal nerve, cranial nerve 5, and it would be associated with nasal congestion, discharge, tearing in the eyes, redness in the eyes. But the big thing was, he said when he has a problem with these food sensitivities, he can get transient dysarthria, difficulty speaking, transient problems with his memory. So I thought that was all interesting, this big concept of the food sensitivities. I found it quite interesting. So even though parts of the book were just flat out stupid, like when he talked about what he actually eats, this thing was actually kind of brilliant. And so, a person could be like an idiot savant. He knows a lot about allergies. That's what he did for a living all day long. He doesn't know much about nutrition. So anyways, I enjoyed the book. I thought it was interesting. It's a fast read. I blew through it like in 2 days. So anyways, hope that's interesting.